Hello everyone, welcome to the Patreon exclusive clinical case discussion video. You're watching Vids Made Simple, and from today we are starting our clinical case discussion sessions. First case of today is a 2-year-old boy is hospitalized with Staphylococcus aureus pneumonia. He gives history of similar bouts of bacterial infections in the past. He had recovered uneventfully from measles 6 months ago. On examination, scant tonsillar tissue is noted with no lymphadenopathy. Immunoelectrophoresis reveals subnormal levels of gamma globulin. Nitroblue-tetraxolium and chemiluminescence assays indicate phagocytic killing. The most likely disorder the child is suffering from is. Okay, so here I'm not providing the options first of all, so you just have to look at this question and read it once again. If you're not satisfied with what I've read, please pause the video once and go through the question thoroughly and look for all the hints and note it down in a piece of paper and look for the diagnosis without looking at the options. Now, okay, once you're done doing that, what you got to do is that we're going to proceed now. Now let's look at the options for this case. Options are defect of BTK gene, defect of SAP gene, defect of WAS gene, ICAM1 deficiency. Now this is a question from Immunology. In order to answer this question, you should be able to get the hints from this question, and with the hints you should be able to diagnose the condition, and when you diagnose the condition you should know the pathogenesis of the condition, and only if you know the pathogenesis of the condition you'll be able to identify the correct gene defect. Okay, so if you have the answer right now, that's well and good. If you don't know the answer yet, that's alright. Keep watching the video. I'll tell you how to solve this question. Now each and every word in this question is actually a hint for us. Let's look at each and every word of this question separately and try to find out the diagnosis. Here the most important hints are 2-year-old boy. Okay, so a 2-year-old suggests that this is a very young patient. The patient is a child, and whenever you see a boy or a man in the question, you should have one thing in your mind. That need not be always the case, but that can be helpful in some cases. You should think about X-linked recessive diseases whenever you see boy or man in the question, because X-linked recessive diseases are common in them. This need not always be present, like all the cases which has boy or a male patient need not be an X-linked recessive disease condition, but in some cases this may help you in diagnosing the condition. Okay, so here I have in my mind, like I think that this may be a condition which is X-linked recessive condition because they have given a 2-year-old boy. Okay, I don't know. Let's move on and let's see what other hints we get here. The second clue is that this boy developed recurrent bacterial infections. Now, this clearly tells us that this boy is immunodeficient. This can be either primary immunodeficiency, where there is some defect in the production of the immune mechanisms in his body by itself, or it can be secondary immunodeficiency, which is induced by external agents like infections like HIV, or due to treatment with corticosteroids. We are not sure about that also, but they have not given any history of treating with corticosteroids or HIV history. Not necessarily they have to give, but still we didn't get any such clue in this question. Okay, and they have also given that this guy doesn't have lymphadenopathy. Now, when a patient has recurrent episodes of bacterial infections, there are many chances that some of his lymph nodes might should be enlarged, right? There should be some amount of lymphadenopathy, but not necessarily, although there should be some amount of immune response linked to lymphadenopathy, but this guy didn't have any lymphadenopathy. So that further adds to our previous assumption that this child is immunodeficient. Okay, and our next clue is that they have told that this guy has low gamma globulins. Now, this further proves that he has less amount of immunoglobulins in his body. But they have also told that phagocytic activity is still present in this patient, which is found by chemilumin. Now, with all these hints in mind, let us look at this question once more. Do you get any of the immunological condition in your mind looking at all? Bruton disease, right? That's all right if you didn't get the answer, but if you got the answer correctly, congratulations. So, if you found Bruton disease, it's 100, I'm 100% sure that you will know the correct answer option in this case. Bruton disease is due to defect of BTK gene, which is Bruton tyrosine kinase gene. Now let's talk about Bruton disease in a bit detail. Bruton disease is also known as X-linked A-gamma globulinemia. Now see here, it is given as X-linked A-gamma globulinemia. That is the other name for this disease. Since it is an X-linked recessive condition, it is more common in boys. See, our assumption has become right in this case. But remember that this need not be true always. Like you may get 100 multiple choice questions where there'll be a male patient or a boy patient referred to in that case, but all the diagnosis need not be X-linked recessive condition. In some cases it can be like 2 out of 100 questions might have used a boy patient or a male patient to give you a hint to diagnose X-linked recessive conditions, for example hemophilia A. And in this condition it was once again helpful for us. It gave a little bit of hint for diagnosis. It is caused by tyrosine kinase, which B cells and plasma cells in these patients. But there'll be some amount of T cell activity and phagocytic activity in these patients. Okay, so as you all know, immunoglobulins antibodies are produced from B cells and plasma cells. Since there is decreased B cells and plasma cells, there will be decreased immunoglobulins in these patients. As I've told you, another important clue in this question is that it's given as it's actually an X-linked recessive disease. That's why we should have looked at the sex of the patient, which is actually a male gender, in whom X-linked recessive conditions are very common. And another important clue in this question is that they're given that he's a 2-year-old boy. In this condition, what happens is, since this child will be breastfed by his mother for up to at least 6 months of age, he'll be getting his maternal antibodies via the breast milk, and so there are less chances for infection in the first 6 months of life. Once the mother stops breastfeeding this child, the maternal antibody starts to deplete slowly, and as the child grows, there'll be decrease in the immune mechanisms in the child, and predisposing the child to various secondary infections. So these patients are more prone to develop secondary bacterial infections like those caused by Haemophilus influenzae, Streptococcus pneumoniae, Staphylococcus aureus, and few viral infections caused by enteroviruses, and parasite infections caused by Giardia lamblia. Now, I think you would have got a basic understanding on Bruton disease and how to solve a clinical case to some extent at least. Keep following with me, and I'll be making more clinical case discussions on Patreon. I hope you understand. I hope you understood something about Bruton disease and how to solve these kind of questions, multiple choice questions. If you have any doubt, feel free to comment below. I'll try to get back to you as soon as possible, and I'll see you in my next case discussion. Bye bye.